Welcome to your 4State.com's Medical Corner. I'm Sajata Khandelwal. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you for having me.
Our first question for you, what is an Achilles tendon rupture?
Well, the Achilles tendon, again, attaches to the back of the heel, and it's the strongest tendon in the body. Now, there is a weak spot in everybody's Achilles tendon, and it's about 6 centimeters proximal to where it inserts. And the reason it's weak there is because there's not a lot of blood supply to that area. We call that the watershed area. And oftentimes when you rupture an Achilles tendon, they're playing tennis and coming to an abrupt stop and you hear a pop in the back, that is where it tears. And usually it feels like a gunshot, or you got shot or hit by a baseball bat in the back. And that's a full-blown Achilles tendon rupture. Now, there are other instances where part of the tendon just tears, and it's not a full rupture. And when the Achilles tendon does rupture, it's kind of like a bag of spaghetti being broken in half and pulling apart. And there's all kinds of jagged edges to it, and it looks really horrible when you open it up surgically. So that's a full Achilles tendon rupture versus just a small Achilles tendon tear.
And how is it treated?
Well, it depends on what happens. If you have just injured your Achilles tendon and it's slightly torn and maybe you feel a little bulb or a thickening back there, that can usually be treated with conservative care, meaning a lift, a heel lift, a cam walker, or a walking boot to immobilize the foot, and a custom-made orthotic. Physical therapy can help that. Stretching exercises and massage can help that tendon heal, and rest. Anti-inflammatories and compression. All these things are used for a small partial tear. Now, unfortunately, we hear in the sports often that someone has ruptured an Achilles tendon completely. Football players, baseball players, basketball players, and when this happens, it's a major problem. And it really, if they're an athlete, it needs to be dealt with surgically. If they're a sedentary person, we can sometimes treat it non-surgically by putting the foot down. And if you plantar flex the foot, that makes the 2 ruptured edges of the Achilles tendon touch, and then it can heal in a shortened position. And then in time, you slowly bring that foot back up. But that's if someone is not really very active. Now, for the athlete, and they rupture it completely, you're going to have to repair that. And there's lots of ways to repair an Achilles tendon. Some are open, and some are closed, like we could do it percutaneously or minimally invasive. It just kind of depends on what the MRI shows if that happens. So bottom line, if you have an Achilles tendon tear, we can treat that conservatively. Usually you don't have to have surgery. If it's a rupture and you're not active, sometimes that can be treated conservatively as well. If you're an athlete and you rupture it and you want to get back to being a sports athlete, then you have to go back usually and have the Achilles tendon repaired surgically.
Thank you, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on your 4State.com.